series. We are on the new patient orientation. We're starting all over. All the forms, anything you need, are always on backtolifechiropractic.com. And this is just to keep you motivated and on track and learn about chiropractic and the benefits from it and how Back to Life Chiropractic works. We're going to set a timer here for 5 minutes. Here we go. So, new patient orientation. Back to Life Chiropractic. There's our website and our phone number. So, this is our goal at Back to Life Chiropractic. We know the question when you're thinking about chiropractic is if there's a spinal misalignment. That's called a subluxation. If you want to learn more about that, you can always go to the website and click on that. Causing interference to the nervous system that is not allowing your body to function properly. Research confirms that making lifestyle changes through diet, exercise, and the way you think will improve your overall health. And is that spinal misalignment a factor in the health problems that you're experiencing, and why is your problem not improving? So, our first goal at Back to Life Chiropractic is to determine if there is a spinal misalignment, which is called a subluxation, as a possible factor affecting your health. Your second goal, overall health score. So, we'll find out by a few tests where you are on this wellness scale. Our third goal is to develop a treatment plan based on your goals to improve your spinal alignment and health score. So we'll figure out where you are on here, and then we'll make a treatment plan for you to get to wherever your goal is. Some people's goal is to get here, some people's goals here, some people's goals here, but we actually come up with a treatment plan that's developed on what your goals are. And then our fourth goal is treating your spinal misalignment or your subluxation through chiropractic adjustments, monitoring your overall health score, and providing services that improve your health occasions. And the fifth is helping you help others get back to life. So we always feel like once you've gotten yourself back on track, then you should turn around and help others. So one of the things that when you start coming to the chiropractor, one of the things that you have to start to think differently is your attitude, sickness care versus health care. So one of the ways most people's attitudes is when you feel great, full of energy, and have no symptoms, do you wake up thinking, I should call my doctor today? Typically, you call your medical doctor only when you're sick or feeling poorly. So care is very important in a time of crisis. Just understand that it has nothing to do with health. Attitudes that drugs are the answer. So if you have a headache, what do you take? If you have high blood pressure, what do you take? If you have pain, what do you take? If you have gastric reflux, what do you take? If you have poor circulation in your legs, what do you take? If your stomach hurts, what do you take? If you're depressed, what do you take? So a lot of people's attitude is that drugs are the answer to everything. So if you get skin conditions, if you have diarrhea, if you have stiff neck, pain in the upper arm, what are you going to take to help them? So doctors are the third leading cause of death in the United States, causing 250,000 deaths every year. They just had a recent, more updated article that was about, I think it had the same results. I need to get that updated. So that out of 250 deaths per year are from just normal causes of going to a medical doctor. So, and then if you look at all this research, you'll see that even though we're ranked very high in diagnostic and money spent, we're actually not the healthiest country in the world. So, where would you rank us? We are ranked 37th. The United States of America is 37th of all countries in healthcare. So even though we spend some of the most money ever for diagnosis and healthcare, our health system is not working properly. We're ranked 37th. So one of the things, sometimes is because of our attitude. We're actually living in an illness crisis lifestyle. With medications, we're thinking medications and things are keeping us healthy, but really, you're not healthy when you're on drugs and getting surgery. You want to be at optimal health. So the question is, where are you on your family? Where are you and your family on this wellness scale? And then the nice thing is that you can figure this out. So a lot of people are down here in the disease state. Multiple medications, poor quality of life, potential becomes limited, body has limited function. Health symptoms, drug therapy, surgery, lost normal function. A lot of people are in this false zone here because they're not feeling super bad. They might be only on 1 or 2 prescriptions, and then there's people that are in good health, regular exercise, good nutrition, wellness, education, minimal nerve interference. And then you have the people that are in optimal health, 100% function, curious development, active participant, wellness lifestyle. So that's it. That was our 5 minutes. So we'll start talking a little bit more about this health scale, some of the purpose of pain. And then if you have any questions, you can always go to www.backtolifechiropractic.com, and there's a comment section in the Back to Life 5-minute workshop series, and you can always ask a question.